The first challenge is lack of assessment for dementia in a primary care level in the community. And I'm serving older adults population. So what I'm saying is aging in place is a priority for public health. However, when older adults has dementia, unfortunately, the only or the unique destination is nursing home. So it's like accelerate the transition from home to nursing home. So I would like to see more tools and resources that they can age in their own apartment and delay the nursing home just because someone has dementia.
Most important, continue education. Knowledge is power. Without knowing that, not going to anywhere. So helping people understand the disease, learn how to live and work with the dementia. But furthermore, I think very important to building the capacity. We need more bilingual, bicultural service provider. Especially, we also need to continue to support frontline worker, such as home health aide, homemaker, community service worker. They are on the front line. They don't pay that much. So they're not able to attract certain people to join as a quality service. And we see that overwhelming the workload situation, people frustrated, hard to serve. So how to build so-called capacity building, to build the capacity in the community level, not just Asian community. I believe this is among all the community face a similar issue to create sense of incentive. Cannot be just you have a good heart. You have to have financially support and also able to continue to increase the capacity to serve all community. Thank you.
I totally agree with Kun. Yes. And we need education because the Brazilian community need to know about the services we have there, they don't know about. And yes, the financial is a big problem. And in my community, they think they have to take care of their loved ones. So they don't know sometimes what intense is this process, what will become. So they should have to take care of their families. And the biggest barrier they encounter is leave their loved ones in nursing homes. They don't want to do that at all. But sometimes we don't have other option.
I would have to say training on both ends. We need more training, not only for the communities in which we serve. We need more champions to help get the word out to the families. We need more people that are interested in sharing the information about dementia, about Alzheimer's, that families need to know what is going on with other family members. There are a few champions, Dementia Friends champions within the neighborhood where I live, and they are in English, Haitian Creole, and other Caribbean languages. But they're all so very busy that a lot of the training falls on in my lap. So I would like to see more people, even if it's a family member that wants to be trained come to an information session and be trained as a dementia friend, so that they're able to share, especially in the BHA housing developments. There are a lot of people living in developments much like what Judith talked about and what Kun talked about. But those developments, the BHA developments, don't have anyone. other than a few people that can come around and tell them, or get them to come to a Zoom meeting and tell them about dementia. So I'd like to see more training on both levels.
What I have found with Dementia Friends is that it does come down to the people. So we do need the resources, we need the translated materials and so forth. You know, we need teaching tools, but in the end, we need people who are part of those communities who can actually do what Arnett is talking about and lead the trainings, because that's where the trust is people who are part of that community. So the last presentation today is going to focus on that, and that we need to have structures to compensate people so that they can do that work.
I can't help but echo what everybody's saying about education and having evidence-based education for people to understand, and especially in the field of intellectual and developmental disabilities. As Bonnie said, the information is constantly being updated as more and more research is being done. The other thing that people need to have is, besides the education and its community awareness, and also healthcare providers to be educated. And there was something in the chat about educating healthcare providers. And there's, as far as I know, there's not as much done in the field of healthcare, because there's so much information that students need to have. So championing that and making opportunities available for any nurses, doctors, anybody in allied healthcare practitioners around dementia. So that's also important. The other thing I wanted to add is that families especially need support and information. But the thing that I have found with a lot of family members is navigation, trying to figure out how to find somebody, where to go, what the initials stand for if you go into an organization, even bridging the gaps between the aging and the intellectual disability communities, and also the Alzheimer's community. So trying to have people with specialties be able to talk to people. So those are things that I think are really important. And the barriers that I have is that in the field of IDD is that there's so many competing demands, and who gets funded? It's like queen for a day, I hate to say. So how do we advocate for people to get the funding that they need to have, and also for direct care, people who are providing hands-on support? There are so many people that we really need to have people, so they need to get paid adequately, and they also need the education and understanding.
So I'm going to drill down as usual on what Kathy has said and focus specifically on physicians and advanced practice nurses. And in the dementia and IDD field, we have a unique problem that I actually think is not so unique now that I'm thinking about it. And that is, we have clinicians who have been caring for somebody for their Down syndrome or whatever the issues are, and then they get dementia symptoms. And oftentimes that one clinician is going to pass the person off to the next. So it's going to go from someone who is an IDD specialist, and now they're seeing a dementia specialist, and the two of them are not speaking to each other. And so they're each looking at one part of them, and no one is looking and caring about the person. And so I don't think it's actually that unique, in that most people who have dementia also have other comorbid conditions. And so what happens when the oncologist is not talking to the neurologist, or we don't really recognize the symptoms because it's an oncologist? So we really worry about that in our field. So what we need most is the communication between the different providers so that they can care for the whole person. Thank you.
Thank you, Kathy and Bonnie. Very important points. And I'll just mention, I saw a question about this in the chat. Massachusetts, where most of us here are based, Bonnie's joining us from Ohio and Nia from Idaho, but the rest of us are in Massachusetts. We are an unusual state in that in 2018, our state government passed a law requiring continuing medical education about dementia for doctors and nurses and some other allied health professionals. And it's hard to implement because, as you said, there are competing demands. There are so many pressures on people doing this work. They often have very brief amounts of time with their patients. So it's hard to achieve, but at least we're moving in that direction here in Massachusetts. And I hope other states will do the same. I think when that legislation was being debated, people were shocked to hear that it wasn't already the case that medical professionals had to learn something about dementia, but they didn't necessarily have to. So we are moving in that direction.
Yo veo la
I
necesidad
see the necessity in the Latin community
que necesitamos,
that we need,
como dijeron, y es
that the same thing everybody has said is
educación,
support, education,
de hecho,
and
una de que tiene su mamá, una
mm,
discípula que tengo en la iglesia,
one of the members of my church has her mother.
frustrada, me habla y
She's
me
very
pide que
frustrated and she calls me all the time. What can we do?
motivar a las familias.
And what can we do to motivate families so that they can unite in this,
En ese cuidado con su familia.
in this area of taking care of their family members?
La persona
Sometimes you
cuida,
can see that the person who's taking care of this
porque
patient
dejan la carga solo a una
so is left only to that one person.
Y creo que cuando yo en mi casa
And I
cuidé
think that in my case, when I took care of
a mis padres, gracias a Dios, el doctor
my
fue
parents,
muy lindo
thank God the
porque
doctor was a great
a
person.
familiares, en este caso,
And
mis
when
hermanos
he
iban cuando el doctor les
realized that when my
ayudara a
brothers
que
would
yo
go
en
to
ese
the
caso,
doctor, he would
yo tuve apoyo
enforce that that my
Pero
family
en
members
cuanto
help
a
me
esta persona
with
con
the
quien
care of
yo
my family.
necesito
But there's many other people
tener
that
apoyo de su
don't
familia.
have
Entonces, muy
this
importante
backup by
que
their
los
family. So it's very important
que los médicos como que
that
hagan una
it's very important that
que
doctors
puedan
get
dar
involved
como
in this
apoyo
and give some
claro
kind
a
of
ella, esa paciente que dice
reference to
que el
this,
doctor no le dijo
because
nada
the
de
doctors, this patient tells me that the doctor
esta
hasn't
madre
said
tiene
anything
peor.
to the other
Eso es
family
lo que uno escucha.
members. This
Entonces,
is
bueno,
going to
saber
get
esa
worse.
información, lo que estaba
So I
hablando
think
Katy,
education,
ellos hablaron de
like
eso, que
Judith
se
has
necesita
mentioned
eso,
and Kathy has
se
mentioned,
necesita esto,
that we do need
que
education,
hacer este
that
estos referentes
doctors
a las familias,
can
porque
help
saben de estos recursos que
and refer
están aquí en Massachusetts.
information to family members to help the caregiver itself.
Apoyo en la familia.
I think we need to have the family help us.
Thank you, Tirsa. So I'm hearing so much about navigation and coordination among family members. So it's not just one person who is involved and other family members maybe stepping back, navigation of resources so that when a person is diagnosed with dementia, they know where to go to get help and support and live life well. Coordination among doctors and other healthcare providers, especially when the person may have more than one medical condition, which is very common. So this is a theme that's coming up, is that coordination.
For my community, most parents in our community cannot read or write English or even their own language at home because they have never been to school. So the language barrier is one thing. And I think our community needs more people or someone who can communicate with them in their language to teach them about dementia or to guide them. Thank you.
I would really like to see the providers be educated, as many of the panel members have said before. One of my terrible memories is I went to the VA to take advantage of the memory care program that they had, but I was turned away because I was told that they didn't see anyone my age there. And they referred me to the VA neurologist, which in turn told me that I did not have dementia, that my scan was a fluke, because I was not demented. Now, if a neurologist will say that, then we have a long way to go as far as education and empathy goes.